Hi, this is Sarah Mikesell with Global Ag Media, and today we're here with Dr. Aaron Lorenz. He is a veterinarian with Four Star Veterinary Service. Thanks so much for being with us today, Aaron.
Glad to be here.
Very good. And we're in Muncie, Indiana at a Four Star Vet Conference that you guys are putting on. And today we're going to talk a little bit about beef cattle and dairy cattle, a message for that audience. So let's dive right into our questions, Aaron. Why should a beef or dairy producer consider embryo transfer?
Right. So, traditionally speaking, producers would use bulls for their reproduction services with their cows. Difficulty with bulls is, half the year you have to keep them in a separate pen. They're just difficult to move and to work with. And on the flip side, or in addition to that, they're expensive to keep just where you only need them for a couple months out of the year.
Right.
So the industry kind of moved towards doing artificial insemination, which is good in that it prevented producers from having to house bulls, but also allowed to select for specific genetics on the sire side. However, that does not affect the maternal side. Embryo transfer then allows hand selection of both sire side and the maternal side. And so you're able to really improve your herd genetics and at a much lower cost than it would be if you were needing to buy the actual animal and trying to breed those animals on site. Whereas if you are able to buy an embryo and put it in one of your own cows that you already have, cheaper genetics for your smaller farms. So.
Very good. And building up that genetic profile in your herd is really important, right?
Absolutely. Both in the beef industry and in the dairy industry, and even in the show industry, as embryo transfer has really taken off in the show industry. As in the ring, they're looking for specific genetics, specific features, and so it's even valuable in that area as well.
Very good. And we certainly hear about that on the beef side, where just the quality of U.S. beef has gone up dramatically, right? And these small producers, like you said, this is one way they can keep up.
Absolutely. Yes.
Very good. Excellent. Well, I guess really, where does a producer start? Let's say you're working with a bull, and they can be demons, we all know, but how do you make this transition?
Right. So the first and most important thing is just excellent communication with the veterinarian that you're wanting to do the service with. This is something that takes a lot of planning and a lot of organization in order for things to go smoothly. So just communicating with them what your expectations are, and starting when you want your calving dates, and then working backwards from there to make sure timing works out well and that they're available for it. And then from there, it depends on what kind of herd you have. If you only have cows that you're wanting to put embryos into, then it's going to start with putting embryos into those what we call recips or recipients. And to begin that process, we'll do a synchronization protocol that will synchronize their estrus cycles, similar to when you're doing AI. And this, depending on what protocol you use, that it may be a veterinarian preference, it may be what works best for your farm. One of the more common ones is called the 7-and-7 protocol, and that's about a 24-day process of hormone injections. So again, it's something that requires a lot of planning in advance. Now, if you have some cows that you think are very special that you're wanting to get embryos out of, it's going to be even a little bit longer process. So you'll start with that synchronization protocol, as well as an additional 3 to 4 days of FSH injections, which then induces their ovaries to ovulate multiple times before you AI. And then 7 days later, you'll come back and flush her uterus and collect those embryos. So all in all, it's about a 32 day process. So once you have those embryos collected, you can either transfer them fresh into some other recipients that you have also synchronized, or you can freeze them for a later use, whether it be in your own cattle or if you want to sell to someone else then later.
Very good. So there's a process for choosing the genetics, right, that you want to use, and that's its own process, it sounds like, right?
Correct.
To work with your veterinarian and genetics company, I would think, right, to make some of those decisions. And then there's the cow side part of it, correct?
Correct. Yeah. So it's really working on two ends.
Right.
And it depends on what you have for a herd. If there's not anything that you're necessarily wanting to replicate or have those genetics continuing in your herd, then you're dealing more with just one side. But if you already have a high genetic herd and you're wanting to cycle that, then you're working with two different sets of cows there. So.
Very good. And what are some of the tips and tricks, I guess, that you have for a successful transfer? Because as you said, it takes planning. What are the things that producers should be thinking about?
Right. So the first one I would say is backgrounding your recipients very well. So that comes from a vaccination standpoint as well as a nutrition standpoint. With vaccinations, modified live vaccines can cause pretty significant issues in your reproductive rates with embryo transfer, so make sure that those are given far enough in advance to make sure it's not affecting your rates. And nutrition is can be a huge issue. I know of a story of one of my mentors who they were having a pretty poor day of transferring embryos, and he was just talking to the client a bit, and he said something about a change in nutrition, and he asked them about it, and turns out they had a 0% pregnancy rate that day just due to the poor nutrition.
Oh my gosh.
Yeah.
It's such a huge factor, right?
Yeah, so it's very important to also loop in your nutritionist when you're trying to get this program implemented.
Very good. What other things make sense to really pay attention to?
So another one is the quality of labor involved with giving your injections for these synchronization protocols. Extremely important on your timing of these injections. We're trying to synchronize donors and recipients to be at the same stage of their cycles. That way when you implant these embryos, the same age of embryo is being implanted in a cow that's in the same stage of her cycle, and that's extremely important for those embryos to implant and to get pregnancies out of them. So farm labor is critical.
So not just anybody can do this, in other words.
Yes.
You really need to know what you're doing.
Yep, absolutely. Takes a lot of work, but when you put the work in, you get some pretty incredible results.
Fantastic. Any other tips that you have for folks?
I think that's all I have for today.
Very good. I would think that just body condition score and things like that are things that you want to make sure really going into this process. It's not just nutrition for right now, but it's making sure that cow is in, whether it's a dairy cow or a beef cow, making sure she's in a good place, right? Yes.
So kind of going along with the backgrounding of your recipients, just overall quality of your recipients is important. I think generally speaking, people tend to focus more on the donor side because that's the genetics that you're trying to replicate. However, if you don't have quality recipients from a fertility standpoint, you're not going to get those pregnancies and you're not going to be able to have a successful program.
Very good. Well, thank you so much, Aaron, for all the information today.
Absolutely. Happy to be here.
Thanks. This is Sarah Mikesell with Global Ag Media.